Touchmark is a really special place because we really focus on the people here. And when I say people, it's not just residents, it's residents, family, and our employees, our team. Our team is the most important thing because if I take care of our team and we work together, then we can provide the best care for our residents and their families.
We basically provide two types of services. One, short-term rehab and licensed skilled nursing services for individuals that have recently had a hospitalization that need additional care before they discharge back home. As well as we provide long-term care for individuals that have got to the point in their life where they're needing assistance with all their activities.
It's a mini hospital, but it's not like a hospital because you feel like you're at home. I have people walk through skilled nursing and ask me, where's the skilled nursing? I say, you're in the skilled nursing. They're like, oh, it looks homey, it looks comfortable in here, and that's the idea.
Everything that you would see in an outpatient clinic, we also have here at Touchmark.
The patients always have the option to choose where they would like to go for skilled nursing. So if they would like to come to Touchmark, all they need to do is tell their discharge planner, I would like to go to Touchmark, and that discharge planner will send me a referral, and I will review, and I will get insurance authorization if needed, and we will get them into Touchmark as soon as they are medically stable and ready to leave that hospital.
You have the right to choose which skilled nursing facility you want to go to, and you can choose Touchmark Skilled Nursing.
We have a wheelchair transportation van. We are able to take our residents here at Touchmark to their doctor's appointments, whatever they need. We have the staff available and a driver available that can help assist the residents with those needs.
The only thing, if they want, that they have to worry about is, meeting them at the appointment and being there. They don't have to worry about that added factor of having to drive them as well and figure that sort of stuff out.
So one of the other things that we do on the occupational side of things is what we call home visits. And what that allows us to do is to actually physically take a patient to their home before they discharge from rehab. And see how they do in their own environment.
The ultimate goal is to make sure they receive the highest quality care possible. Whether their goal is to get to short-term rehab and discharge back home, or live out the rest of their lives with the highest quality life possible based on what their condition is. And it's our job to make sure that we meet their expectations.
I'm concerned with patients' mobility. When someone comes in, I try to get to them as soon as I can, get an evaluation, and just look at how they're walking, how they're transferring, how their balance is, and try to figure out what I can do to help this person function better, get around better in their home environment. That mostly takes place but either in a patient's room, so that way we can kind of simulate either their home setup, or probably the biggest bulk of our time happens in the therapy gym where we have all of our equipment. As much as we love working with the patients while they're here, we want to get them to the point where they don't have to come back.
We encourage that families participate in therapy so that they can see what's going on, and just that we really all have an open door policy, so anytime they would have questions, we would just want them to really feel comfortable coming to us anytime.
I am in the gym area, and in the gym we have a little kitchen that's set up that a lot of times occupational therapists will use, so that way we can work with patients that if they're going to be going home, if they're going to be cooking, if they're going to be using a stove, those types of things. If they're going to be doing that with their home, we want to make sure that they're safe doing that.
My job is to not teach you how to do what you already know how to do. Occupation is anything we do in the morning from the time we open our eyes, lift our head off the pillow, get out of the bed, get dressed. Activities of daily life. I tell people that my job is not to teach them how to do that. More times than not, it's to show them a different way.
Part of my job is not only to manage the medical side of a patient's needs, it's also to be available to families, to be able to discuss openly the cares that are being provided, the cares that are going to be anticipated upon discharge and going forth. Yeah, it takes a lot of hard work, not only from the patient's side of things, but also the staff's point of view, to make sure that we are all working together for a common goal, and that goal is to get this patient stronger, healthier, and go home.
I was in the hospital for 8 days, and I really was sick. When I was released from there, I came to Touchmark, and it was nice because I really felt like I was back home again.
They're well trained in skilled nursing. I really felt the training was there. The personality is there too, which is probably the best thing.
What we do to make sure that we're getting the most holistic approach to the care for our residents is we meet as a team every day of the week, and we have specific meetings that we get together to talk about the care for each individual.
I get to spend my days working collaboratively with the nursing staff, with the caregivers, with the therapy team to find the best discharge plan for the people, the families that are coming in for rehab after a hospital stay.
So as a team, we all have to be kind of on the same page and talk to each other on a daily basis so that we know that we're setting ourselves up to have the patients go home to their prior level.
Well, we're very proud of the fact that we've been able to maintain the CMS, that's Centers for Medicare and Medicaid, 5-star rating for our nursing home. You know, we've been able to maintain that continuously since 2011, and we're not going to rest on our laurels. We're going to do what it takes to maintain that.
Everything about skilled nursing, from the nurses to the staff to the physical therapist, was really first class. I wouldn't want to go anywhere else, and I most certainly would recommend it to all my friends, to anyone that could hear me talking now.
My experience was all positive in skilled nursing, so I can't say enough for it.
If anybody would like a tour of our Touchmark Skilled Nursing Rehabilitation, just give me a call and I will give you a tour, show you around our skilled nursing and rehab, introduce you to maybe some of our therapists, some of our nurses, answer any questions that you might have, and I'm always available on phone to answer those questions as well.
I absolutely love what I do.
I love what I do.
Love coming to work every day.
I love my job.
Very few people in life, I think, wake up and know exactly what they're supposed to do every day of their life, and I don't have that problem. I show up at Touchmark every day, loving my job, loving the people I work with, and most importantly, loving my patients.
I love my job.
I love what I do.
I love what I do.
I love what I do.
I love working here. I wouldn't want to be anywhere else. I feel super lucky that I started out with this company because Touchmark allows us to have the resources to really give everything to our patients that they need.